been a year full of a lot of successes, but we've not been without our losses as well. We certainly feel the loss of Seth particularly greatly, but we know he would have been so proud of the work we've accomplished in the year and how often we speak his name, and we will continue to miss him greatly. To recap, we kicked off the year with a statewide sequential intercept model mapping event in February with the National Center for State Courts, which has provided us with recommendations to move forward. That publication was distributed during our last meeting, but if you need a copy, there's some in the back, which I don't really know where the back is. Over to the side, maybe. Next, we held the inaugural Mental Health Summit from May 31st to June 2nd. And in October, we received our evaluation findings from Western State University, and a copy has been provided to each of you in your materials that are at your table here today. And I just want to highlight a few of those findings. We had 95% of the participants agree or strongly agree that attending the summit was a valuable use of their time, and 96% of the participants agreed or strongly agreed they would recommend a future mental health summit to their colleagues. 93% felt that they gained knowledge from the summit that would help them grow professionally, and 95% intended to incorporate what they learned from the summit into their professional practice moving forward. We've even heard back from several communities and their teams who have met independently since they've gotten home from those conferences. We're certainly always looking forward to the next opportunity to offer a mental health summit again. However, the issue will certainly come down to funding. As you can imagine, it's a big undertaking. We would like to start planning a 2025 summit. So I ask if you have any ideas on how to fiscally support a summit, please let us know. In August, we decided to begin a state listening tour, and we coordinated our first town hall with in association with the Kentucky Bar Association, Kentucky Law Updates. The first one was in Owensboro. I hope each of you had an opportunity to attend at least one of these 9 meetings. They were very humbling to attend and to get to share, listen to the individual share their experiences trying to navigate mental health issues and the court system and community services. Each time we learned more about the barriers that face our Kentucky citizens, and some barriers we had never even considered or thought about. They were very powerful 2-hour meetings. We had to stop promptly at 8 o'clock because of our contract with the audio-visual folks. But power, if you will, of those meetings and the people participating, I think would have gone on for much later times than we had available to us. There were more than 1,000 attendees across the 9 town hall meetings, and I have the numbers available if anyone's curious as to those numbers. But we held them in Owensboro, Covington, Ashland, London, Lexington, Paducah, Louisville, Pikeville, and Bowling Green. And we will have data from the town hall meetings in coming weeks. We did take notes from those meetings via Zoom. I don't know how we did that, but I guess we did that electronically. That data will include demographics of those who completed a survey, either by the old-fashioned pen and paper method or electronically. And the survey will be used to identify common themes across the state. Barriers will be identified and shared with the appropriate commission work groups. And the themes will be shared with Department of Specialty Courts, who will host regional trainings in the fall of 2024. The curriculum will be developed with these findings in mind, and we are planning to offer up pop-up town hall meetings during the daytime hours. Again, we're trying to be conservative financially and not have, not spend money we don't have budgeted to cover those costs. But as you can tell, if we only hit 9 cities with those town halls, that's a pretty limited number of towns. So we're going to try to sit down in the new year and figure out how we can manage to have these town halls in some of the other outlying cities that weren't covered. And we will be asking some of you judges and community leaders to help lead some of those town halls in your areas, I'm sure. I would like to take a moment also to thank Secretary Friedlander and his amazing staff who shared the head table with us at each event. This showed a unified effort between the cabinet and the courts on improving both of our systems simultaneously. I see Colleen here today, and she shared the table with us a couple of times, and Dr. Marks as well. Someone else that shared the table with us. It was quite a daunting time to sit up there willing to take all comers and their issues that we had no pre-filed notices on what their concerns might be. So we hope we handled the questions and concerns well. The cabinet also ensured that there was a crisis staff on site at each meeting in case someone needed to talk to a counselor. I'd also like to thank Katie Comstock and Rachel Bingham at AOC for offering support staff at each event, and a special thanks to each of you who showed up to represent your agency and the commission at those meetings. The commission was also invited to present during the interim joint committee on judicial and health services this past month. Thanks to Senator Westerfield and Representative Moser for those invitations. We were excited for that opportunity to share the amazing work that the commission has done since its first meeting in September 2022. Lastly, the commission has welcomed a new administrative support coordinator, Rebecca Heisel. She's here today, over to the side. Rebecca, wave again. Becky's main office is in Jackson County, and you'll start to see correspondence from her. We're excited to welcome Becky to the team, and I think she's excited to be here. We also will have a new attorney starting in with the commission in January, and I look forward to introducing her at our next meeting. You'll also find in your materials the schedule for the 2024 commission meetings, and you'll receive a calendar invitation for all these dates tomorrow. Do we have anyone here today? We'll start first with Zoom. Do we have anyone here today on Zoom that it's your first commission meeting? It's always a little difficult to know who's going to go first on Zoom. But, see the distance. Far away. Tell that anyone's here.
I think it's okay. I don't see anybody.
Okay. All right. Anyone here in person that it's your commission meeting, your first commission meeting? Okay, we have a hand up. We'll pass the microphone. And if you could just please speak into the microphone and introduce yourself, please.
I'm Crystal Adams. I'm the Assistant Director with the Division of Developmental and Intellectual Disabilities.
And anyone else? I'm really excited that Crystal is here, and stay tuned for some exciting things that's going to happen on the autism front. Crystal. We realized after the SIM mapping that we needed to look at reentry as a priority of the commission. And that's why we invited the Department of Corrections here today to offer a reentry simulation. And it's critical for us to understand how difficult it is to reenter society after incarceration. And we are certainly very grateful to the Department of Corrections and the volunteers at Blackburn Correctional Institution or Correctional Complex for sharing the morning with us. It was quite an interesting presentation, a very interactive presentation in which I went to jail twice, and I believe my co-chair, Chief Judge Thompson, went to jail every time. Yeah, there was something to be said for consistency. But in this reentry simulation, Judge Thompson and I and a few other judges in the room, who I will not name, but we and other persons who participated learned just how difficult it is to navigate the community and navigate the orders from the court and stay out of jail when you're first released from prison or incarceration. So to further explore that in Kentucky, we have invited Kristen Porter, Director of the Division of Reentry Service, to present today. Kristen, thank you for being with us here this morning. And we are very excited to hear from you. She is going to be presenting here today from the podium.
Good afternoon, everyone. Can you hear me okay? Okay. Thank you very much for having me here this morning for the reentry simulation. It was my pleasure and my staff's pleasure to put many of you in jail this morning. I really do honestly think it was a wonderful experience. That is one of the best things that I think that we do and we host in the Department of Corrections, really for the community to understand many barriers that our population faces. There's a lot of times in all of our jobs, you know, whether you work in the court system or no matter what your role is, that you think you know a lot of the barriers that our population faces, but sometimes there are things, I heard someone say just time. Time is a barrier. There are so many barriers that you just don't even think about that our population faces that really the simulation puts it all right in front of your face. So thank you for being willing to participate in that this morning. I really do think it's powerful, and I know our population very much appreciates you taking the time to do that. So I did want to take just a few minutes. I've got about 30 minutes that I'll talk to you today to talk about the Department of Corrections and a little bit of what we look like and some things that we're doing. I know that with the Mental Health Commission, there are so many areas that you all are focusing on, and really reentry and helping the criminal justice population is a huge part of that. And there are a lot of services that are being offered, but I do want to talk about kind of how they're being offered, where they're being offered, and what that looks like. That way you can make informed decisions as you're meeting as a committee and a commission to really go forward whenever you're talking about different services that you want to campaign and advocate for as well. So everything I'm going to talk about today, I'll talk about from the Department of Corrections seat. As you all know, in the Department of Corrections, we have a mission to do two different things. Our mission is to protect the citizens. But the second part of our mission that we're really going to focus on today is really to provide opportunities, and that's where reentry comes into play. So, of course, we do want to keep the community safe, but in doing that, we want to provide those services as well to hopefully help people not return back to us as well. So just to show you a few little statistics, the Department of Corrections, we have quite a large population. Kentucky is one of 2 states where we house half of our incarcerated population in our county jails. So we have state inmates in 14 prisons across the state and 74 jails across the state. So that's 88 locations where we have state inmates. And that's also not including our reentry service centers and our Recovery Kentucky centers as well. So lots of places throughout the state where we house our state inmates. Out of these states throughout the United States, we are high, unfortunately, for a few different things. In Kentucky, we're high for overall incarceration. We're high for female-specific incarceration in comparison to other states. And we are high for incarceration amongst parents. So those are a few different things that, you know, Kentucky, we want to be known for a lot of things, but those are a few things we don't really want to be known for. So that's why really having work groups and committees and commissions like this are so important to focus on things that we can do to decrease things like that. When you look at the Department of Corrections, we obviously have a huge incarcerated population, but the other thing that we have is we have a lot of individuals that are not incarcerated, they are on supervision in the community with our Division of Probation and Parole. And if you see that number up there, there are almost 50,000 individuals. So between those that are incarcerated and those that are on supervision in the community, we have about 70,000 individuals. Thank you. So between all of that, there's a huge task that we have in the Department of Corrections. So about 70,000 individuals that are coming to us looking for help and guidance as they're serving their sentence and completing their time with us. On average, every year, we release about 13,000 individuals from custody. So that's a lot of people coming in and out of our system. So as I was saying, across the state, many places where people are coming in and out of incarceration, we have 14 prisons, 74 county jails, 20 reentry service centers, and 13 recovery Kentucky centers. So when people are coming out of incarceration and coming back to the communities, they can be coming from a whole variety of different places. And sometimes the services that are being offered at the places look very different from one location to another. In the Department of Corrections, it wasn't until February 1st of 2018 that we really took a moment and took a step back and realized what we've been doing really needed to change. We saw throughout the state the recidivism rates were going up and up and up, and it really wasn't working. We weren't being effective. We kept seeing people return to us. So at that point, there was a lot of things that needed to change. Different programs needed to be put in place. A whole new division was created, and that is when the Division of Reentry Services was created. We actually had 85 dedicated staff, and that's who some of you all met this morning, some of the staff that are dedicated to solely having their only job is to focus on reentry services, whether that is employment or teaching programs or being there to provide tangible resources, such as making sure that someone can get a job, be able to get an ID, make sure that they can get from point A to point B with providing transportation, making sure that they can do all of those things without having to do the things that we were already doing in the Department of Corrections, being a classification and treatment officer, being a probation and parole officer, being a social service clinician. Most of these services were other duties as assigned before the Division of Reentry Services was created. So by creating the division, this allowed staff to be solely dedicated to this. We have in this division staff that also are able to start helping someone while they're incarcerated, but then also continue that assistance for when they are released. So we are one of two divisions in the Department of Corrections that have staff that help people while they're incarcerated and then continue upon release, where most of the Department of Corrections actually helps people while they're in custody or while they're released. So you have people that work in the prisons, but then also people that work in the community, where our divisions, and you'll see over here, Director Johnson, I know many of you all are familiar with them, with her as well. Director Johnson also has people in addiction services who also does the same thing, where they help people while they're incarcerated and then also upon release as well. Many of the different things that we added when the Division of Reentry was created is really working on training our staff that are hired in the Department of Corrections too. So the reentry simulation that we did this morning, we started putting that in our basic academies when we started hiring new people, because the culture in the Department of Corrections really needed to change. We needed to make sure that as we were hiring people, they were working on helping the population instead of punishing the population. People had already been sentenced at that point, and we needed to make sure we were working on trying to help and change people's mindsets throughout the department. So everyone that is hired at this point goes through a reentry simulation. They go through training with core correctional practices, different types of programs that we can do to really change their mindsets on when they're helping the population, how are they doing to really make a difference and not worry about any type of punitive behaviors, anything like that as well, whether they're working inside the prisons or in the community and the probation and parole offices too. One of the things that we do a lot, and there are so many faces in this room that we work with, is we work with many different interdepartmental, but also across cabinet collaborations on a lot of different projects. Really because in the Department of Corrections, we are not the experts in many areas. We have education and labor cabinets, we have the cabinet for behavioral health and services. There are many different cabinets that we work with on a lot of different projects to really bring a variety of services to our population. And a lot of those projects come through the Division of Reentry Services to bring them to our population as well. So we'll talk about those here in just a minute as well. The other thing that we do is a lot of programming that we'll talk about too, and really having a good oversight of programs. So making sure that there's a lot of the cognitive behavioral therapy programs that are offered to the population to really make sure that they can change their thinking and their mindset while they're in the Department of Corrections. It won't change. Thank you. So up until the Division of Reentry Services was created, what we did a lot of times in the Department of Corrections is we made sure someone had a home placement. We made sure someone had a place to live whenever they were released. But beyond that, we weren't really doing a good job at all of the other things. So what we do now is we have dedicated staff that work prior to release that are located in all of the state prisons that focus on all of these release services that you can see listed up here, that you'll see up here. The identification, making sure that people are trying to be released with a state ID. We work with the Department of Transportation, and this project is funded through the Kentucky Opioid Response Effort and also by the Kentucky Chamber Foundation, to make sure that when someone's released from custody, they can be released with a state ID, not a driver's license, but a state ID. They can have a birth certificate, they can have a social security card. So for those of you that got released from custody this morning in the reentry simulation and you didn't have one of those things, and you had to go stand in the long line to get your ID, that's a barrier that we realized was happening in the Department of Corrections. So one of the things that we try to do at the Division of Reentry Services is realize what barriers are happening and what can we do, what agencies can we partner with to really eliminate those barriers. So that's one of the things that we are so thankful for, that we've been doing that project for a few years now, a couple of years, and it's been so successful. We've really heard so much positive feedback from the population, because that's something that as soon as someone's released from custody, they're eligible to get a job day one. So that helps them be a productive member of society the moment they're released from incarceration, which is huge. Making sure that we are bringing resources to the population. So you heard someone this morning, those of you that participated, say, we just held a reentry sim and a resource fair at Blackbird Correctional Complex. And what he meant by that is many of the local community resources, we will bring those into the prisons, host a resource fair for the inmates so they can gather those resources to have them at the time that they're released. So they know when they're released, we're going to go in the communities to get resources and have the names of everybody to contact and know really everything that they're going to need. So we host those while they are incarcerated, but also in the local communities too. Making sure that we have secure employment for our population is huge, because we know that having a job is one of the #1 factors to recidivism. So if someone doesn't have a job, they will likely end up back incarcerated with the Department of Corrections. So we do have actually 11 at this point. We call them REPAs, Reentry Employment Program Administrators. They were originally funded by Commissioner Marks now. We started in 2017, I believe it was, with 4 funded by the Kentucky Opioid Response Effort Grant, and over time expanded up to 11 across the state. And I believe that we can say we were the first project to come off of grant funding, off of that to be taken and actually absorbed into state funding because that was so successful. These individuals, what they do is they spend 80% of their job meeting with people that have been released from incarceration and getting them a job. And what they do is that's 80% of their job. The other 20% of their job is they are literally going door to door to local businesses and campaigning and explaining the benefits of being a second chance employer, making sure that people know the federal tax benefits and all of the reasons why it is beneficial to hire our population. And of all of the populations, our population is one that needs that second chance. They need that fair chance. They don't need a false hope. So making sure that we have a good, really filing cabinet, I guess is the best term I could say, of employers that would be willing to hire our population is key. So they meet with everybody, make sure that they have a good job lined up for them. They have a 57% success rate, which is huge for a program that we have at the Department of Corrections to make sure that people can have a job and make sure that they're successful whenever they're released from custody. So that has been very, very huge, very beneficial for the population. We've seen a huge success and a lot of people have obviously really benefited from that. The other thing that we've done, and this has been funded by, I saw Vanny Grom on here earlier, funded by the Office of Drug Control Policy. We have worked with Addiction Services and the Division of Probation and Parole and many other entities. I know Administrative Office of the Courts also with the ASWs are able to take advantage of this too with DPA. We do a transportation pilot to where if someone is in need of having transportation to get to a court appearance, to get to a doctor's appointment, to get to treatment, to get to any type of visit that they need, to see their probation officer, anything like that, we actually work with the Department of Transportation. We have the Medicaid brokers that we contract with, and they can actually get from point A to point B free of charge, funded by the Office of Drug Control Policy. So that's been a huge win-win for our population because transportation, as you saw this morning, is a huge barrier, especially in some of your rural areas where there isn't public transportation in your Jefferson counties and your Northern Kentucky or your Lexington areas, or even in some of those areas, as you may have seen or heard, where the public transportation gets shut down recently as well. So being able to overcome that and combat that has been something that we've been super excited about as well. Making sure that education and those referrals to education are lined up. We have been working with adult ed to make sure that we have GED referrals, a streamlined process for that to enhance education. We have clothing closets that are in our probation and parole offices. So if someone does have a job interview, there is a nice dress shirt, there's pants, dress pants, things like that that they can have to wear to them, and a whole plethora of programming. So you'll see on there, and I'll talk a little bit more about this here in just a minute, but there is all kinds of programming that we offer. There's all kinds of substance abuse programming. We have different treatment modalities that we offer. There is different cognitive behavioral therapy programs, sex offender treatment programs, life skills programs, employment programs that talk about resume building. So all kinds of mental health programs, of course, as well. So really any type of barrier that our population faces, we do have a program that they can take and really attend. One of the things that really COVID, there's a lot of things that we don't like about when we went through the pandemic, but one of the things that we did gain from the pandemic in the Department of Corrections is really it forced us to look at alternatives for programming and making sure that we have a variety of programming to allow different types. So we do have programs that we offer virtually as well as in person as well for the population, which really helps people if they do have a transportation issue as well. You can see on there, obviously, if someone does have a home placement issue, we do have reentry service centers throughout the state and Recovery Kentucky centers as well, but they can use as temporary housing. The Recovery Kentucky centers is where someone can go and do residential treatment as well. Is your door now? Okay. Yep. Okay, so one of the things that we also have done in the Department of Corrections is we really we will try in many instances to try to look at legislation that comes down and see in different ways where we can enact it, but also leverage it to our benefit. And this is one of the things that we did with House Bill 284 in 2020. We really have a huge population. And you heard me say the numbers earlier. When you look at the population on supervision in the community and those incarcerated, even if you have every employee in the Department of Corrections that's teaching a program, we still can't get programs to everybody. So we have to count on community partners to really help provide programming to our population. So one of the things that we did is we took the House Bill 284, and really what that House bill is it allowed people on the community supervision under probation or parole to be able to get good time credit for completing a program. So anyone who is on supervision and probation or parole, or if they are incarcerated, of course, and they are parolee, somewhat they can get good time off of their sentence if they complete a DOC-approved program. And you'll see there's some guidelines that are listed up there. I'm not going to read them all to you. Everyone's educated in here enough. I hate it when people do it to me. So, but one of the things that we did in the Department of Corrections is we thought, you know what, we need to expand programming. Obviously, there is a huge benefit with expanding programming because this gets more programming to the population. People do get good time off of their sentence, and it's fiscally responsible for the department too, because then it lowers the amount of time that people are incarcerated too. So we have people that we monitor the programs, we do quality assurance and fidelity of the programs as well. The people that are teaching the programs are community providers and community members. They enter into a non-financial MOU with the department, and we monitor that to make sure everything is okay. Because of all of this, there's been an increase in programming and an increase in good time awards. You can see down here, and I don't know how to get that little guy off of there, but under it, what I'll tell you it says is in 2017, there was 6,845 programming completions. In 2022, I can't remember the exact number off the top of my head. I really wish I could, but there was about 23,000-ish. I don't know. I know y'all got it in front of you. I don't know if anybody can tell me exactly.
23,886.
23,886. I did better than I thought. 23,886 program completions, which is huge. Because if you look at 23,886 program completions, 90 days off of the sentence for each one of those programs, that's a huge fiscal savings for the state. So that is huge. Also, that is a huge, huge contributing factor to a reduction in recidivism as well. Because I don't care if someone is getting into a program, just because they want the 90 days off their sentence, they're going to learn something while they're sitting in the program. So that's a huge factor. So some of the things that we also do in the Division of Reentry is we host different events. We host expungement sessions. We partner, very, very, very thankful to partner with AOC and DPA and Probation and Parole to host expungement events. Our population in many instances, they don't even know if their charges that they have, sometimes they don't even know what charges they have. So they don't even know sometimes what charges they have, and they don't know if they're eligible for expungement whenever they're finished. So just getting that information out is huge. Obviously, you all know we host reentry simulations. I did want to say too, if any of you all are interested in hosting a reentry simulation back in your areas, for your staff or anything, just email me. That's something that we host throughout the state as well. So I had mentioned that here and there to a few of you, so just email me and we can coordinate that. And then we also do job and resource fairs. These look very much like a kind of like your college career fairs. We bring employers that will be able and willing to hire our population into the prisons, set them up just kind of like this. The inmates walk around and they make points of contacts with employers for when they're released, so they can go on and have that job lined up at the time of release. Some of the different projects that we have going on, of course, the state IDs I talked about. We have been working with continuing medical treatment with Hep C and HIV. in some of our local county jails. So that's a project we have going on. We were super excited. The Office of Drug Control Policy this summer had some funding that they shared with the Department of Corrections to be able to distribute Narcan kits. And because of that, we were able to disseminate over 17,000 Narcan kits to people that were being released from incarceration, which was huge. Transportation vouchers, we talked about. Employment pipeline is something that we are partnering with the Kentucky Chamber of Commerce and the Education and Labor Cabinet to really have both of those entities be our champion in the Department of Corrections to bring us employers who are willing to hire our population and us go on and partner with them to pair someone who's being released from incarceration, who has the skill set that the employer wants. That way, as soon as they're released and they're going to that area, then they can go on and start that job. So that is a new project that has started this year that has really kind of taken off, really trying to get someone a job day one at the time that they're released. The technology advancements has been something that we've been working on for the past couple of years, and it's been a little low key because it was a grant funded project that in the next couple of months, we will be expanding statewide. So you'll hear more about it. But it's been very exciting because it is something that we worked with Marquee Software and SimCoach Games. So how many of you in here have played any sort of a game on your phone? Candy Crush, anything like that? Okay, so our inmates, in many instances, they get left behind in the world in a whole lot of ways, but technology is one of those ways. And so in many instances, they really will get released from custody and not have any clue how to use a phone or how to use an ATM or how to do, I mean, if you think about how advanced our world is in so many ways, they just don't know. So one of the things that we really thought about is, you know, how can we really bring them up to speed in that world? So we took our reentry simulation that we did today and showed you today and worked with Marquee Software and SimCoach Games to build that and put it on a game. So we took that, put it on a mobile application, and it was installed on the tablets that the inmates have. And they can take that, play that, and it's literally like, you know, does anybody remember the Sims game where you got the diamond above your head and all of that little avatar guy? So it's like that, and they have to walk through the city and be successful, and they either are successful at the end or else they fail, and then they go back to jail. So they really learn all of the things that they have to do whenever they're released from incarceration. So it's really preparing them to be released. So that's one of the games that they can play. The other thing is an employment simulator. So they have to sit through a job interview. And in this employment simulator, they sit and they go through this job interview, and the avatar that they have will start slouching down or chewing gum or not looking, and they have to actively make him sit up and pay attention, all of these things. And then answer questions, and it'll teach them how to do things like address the awkward questions of, where have you been the past 5 years and why do you not have any employment history? So things like that. So these two mobile applications we have worked and created and developed, and they have been put over the past couple of months on the inmate tablets. We've been gathering data to study and measuring to see how successful people are going to be at the time of their release after playing these. So I'm excited to really see the success rates after these, but we are in the next few months going to release them out past the pilot prisons to all the locations in the state. We also just started a new employment program in November to really talk to everybody about those employment skills that they need to have, make sure everyone has a resume, and to make sure everyone is employability ready when they're released. And then in January 2024, this is our most recent thing that's getting ready to start. You may have seen a news story about Goodwill receiving a $4 million grant from the Department of Labor. We are partnering with them to be able to look at people that are being released from 7 different prisons and 2 reentry service centers throughout the state, going to the Jefferson County area, who are going to basically have reentry on steroids. They're going to have a specific reentry case manager. They're going to be, Goodwill's going to hire them to work for them, and they're going to be given financial incentives, a whole bunch of things. So that's something that is getting ready to start in January as well. So the whole point of all of that is in the Department of Corrections, we now have a division that is working on trying to pilot a lot of different projects, all kinds of things to really see, okay, what are the barriers that are happening? What is going on? Why are people not being successful? And when we can see what it is, then trying to overcome that and combat that. If you want to see in more detail, because there's a whole lot that's going on, there are a lot of things. When people are released from custody, they're given resources, they're given snapshots of the area throughout the state. All of it is on our website. So you can go to the Department of Corrections, you can click on the reentry tab, you'll see it up there, and we're broken down by regions throughout the state. So you can see all of that on there. There's a fun little reentry video on there, and it's got on there different events that we have going on. So you can find out all of that on there. The last thing I will say, because I'm about at my time anyways, is one of the biggest things is all of these things that we've been doing. It shows in the numbers that it makes a difference. All of the additional programming, all of the additional pilot projects, all of the additional resources and the services, if you do this for the population, if you're able to make sure you give them services, give them dedicated staff to be able to help them with all of the things, all of the barriers that they're facing, it really makes a difference. And you can see this in the numbers. We were at a historic high at 44.56 in the Commonwealth of Kentucky. And then this year, we released a historic low. So for the first time ever in the state, we were at a 27.15% recidivism rate, which is great, but that's still 27.15% left of room for improvement that we've got to go. One of the things I will say too is when this year, the way that we measure recidivism in the state of Kentucky is we measure it with a return to incarceration within a 2-year period. We are getting ready to release our recidivism numbers for when people were incarcerated and released during COVID. During COVID, programming and resources were shut down in many instances. So you will see recidivism numbers probably increase. So that's even more of a reason to show that all of this is needed. Any questions? Yes.
I want, when they do the simulation games, what do they do them on?
So in the prisons, so those are piloted in a couple of our prisons. It's not statewide yet, and there are tablets in the prisons. So they have a tablet and they're on their tablets. Does that answer your question? Okay.
Phone, so.
No, they do not have a phone.
Yeah, I figured, a restriction of some sort.
Yeah.
A restricted device, so.
Yeah.
Who pays for those tablets? Is it private money?
The tablets are paid for, do you know, Sarah? I know it's a contracted vendor. I don't actually know. I can get you that answer though.
It's not, I was wondering.
I can get you the answer, but I'm honestly not sure.
We have a virtual question.
Oh, yeah.
Well, I hope it's a real question from a virtual participant. The slide that your last slide, Kristen, I think that needs to be touted far and wide. I haven't seen, that's the first time I've seen that it's not just a low number currently, but it has been a trend that, as you said, it's gone on for many years now since these strategies were implemented. I don't really have a question as much as just I'd love to see this in different publications and publicized, because as criminal justice policy and particularly relevant to this, correctional policies being debated, you can't dispute the fact that we're headed in a good direction and this is good for everybody.
Absolutely. Thank you, Damon.
Kristen, did you define recidivism as 2 years?
2 years.
And arrest in 2 years or incarceration?
Reincarceration. Yes. Yes.
Right. I was just curious, you have 88 different facilities that are housing state inmates. And so you're talking about job fairs. Are those conducted for like your county jails as well?
That's an
or are they?
Excellent question. So I'm so glad that you asked that because one of the things I meant to say, and I did not say this. So I said earlier at our state prisons, all of the people that are being released are helped with the things that were listed up there. That is not the case for everyone being released from our jails. We are not funded. Our division was actually created unfunded. So we were an unfunded mandate. So no funding was given to the Department of Corrections. So I have begged and borrowed and stolen to get where we are now. And I'm not ashamed of it. I'll say that anywhere and say I'll continue to do it. And so God love Commissioner Marks next to you because she knows I come knocking at her doorstep just trying to ask for money anytime, trying to get anywhere. So in order to try to help the population that we have in the jails, she actually has given us funding to be able to have 5. We have 7 in total. We have 5 funded through the Kentucky Opioid Response Effort and 2 funded through Senate Bill 192 funds to be able to help at 19 of our county jails. All 19 of those jails have a substance abuse program. So they help with releases that are coming out of a substance abuse program. But the other 74 minus 19, the other ones do not have those reentry services. We've submitted a funding request for an expansion. I will keep my fingers crossed.
Hi, this is Denise Clayton. I'm wondering how this program is different than what I understand the proposed program by Senator Westerfield called Justice Link. Could you tell me the difference between the 2 programs?
I will be honest, I am not familiar with Justice Link, so I'm not positive. I will have to research that and then get you an answer.
All right, thank you.
Any other questions?
I would think that the funding request will probably have that graph as a cover.
Absolutely.
That is a very impressive graph there.
It is absolutely included.
Thank you so very much, Kristen. What a really good presentation. Almost as good as that workshop you held this morning. And I would suggest that if anyone gets a chance to do that simulation with Kristen and her team to do that, it was very enlightening. We have certainly intentionally focused much of our meeting today on reentry because we feel it's necessary for the commission to actually establish a reentry work group. We think that certainly is a great need given our prison population. Does anyone have any particular thoughts on that here today? Any objections to that being made a part of our focus as a work group? We think that it would fit the best under the Criminal Justice Committee, Judge Meyer and Judge Tackett. Do you agree?
Yes.
And then next we would need a work group lead, and we're thinking maybe our commission members from the Department of Corrections, Sarah Johnson, maybe could help with leadership or recommendation from, for a work group lead on that. So, and once that lead is decided, Shauna can contact, that lead person for the next steps. And next on our agenda is, committee and work group updates. Do they need to do that right now in person?
No, they can go.
Okay. And so I'll turn it over to Judge Meyer for Criminal Justice Committee update.
All right, good afternoon, everybody. Not directly related to our work groups, but a few things I've been asked to touch on before we get to the good work they've been doing. One, the opioid abatement. The opioid symposium was held in October. I know that many of you were there because I saw you there. And it was a great group of presentations. Judge Mullins presented on Senate Bill 90, which many of you are familiar with. His county was the first county to pilot that program. My counties, Clark and Madison County, were the second and third, and then several of our colleagues here have pilot counties for that program as well. So Judge Mullins talked about Senate Bill 90. I presented on drug court progress, not perfection, and I didn't do it there, so I have to do it now and say thank you to the fantastic specialty court staff at AOC who helped with my presentation, and by helped, I mean carried me almost to the finish line so that I would be able to present. I didn't give them their credit when I should have, and so I feel compelled to do that now. So thank you to everyone who helped with that. And we also saw some really good presentations on other things that I think really relate to the Criminal Justice Committee, which would include MOUD in jails, first responders, and recovery services. And these were some really neat takes, some different perspectives from what we might share with one another in our own professional settings from time to time, to hear about first responders' responses and impressions and how they might be better utilized as part of recovery services, and perhaps initiating or identifying people who would be appropriate for continuum of care, which again, I think really speaks to the pre-arrest and diversion work group that is part of the Criminal Justice Committee. And also when we heard our jailers talk about the, not just MOUD that is offered in their facilities, but those facilities that also offer other reentry services like what we've talked about today, including transportation, assistance with housing, things that are essential, like helping folks line up information to get their insurance reinstated, to get IDs. And that's again coming out of county jails, because what we were talking about, those services just a moment ago, come out of prisons. And it's absolutely essential that our county jailers are helping people who are being released have a soft handoff, so that transition is a little bit easier. So the opioid symposium was fantastic. It was great to see everyone who attended. Always a good contingent of social workers at presentations like that. And since they're so essential, we're happy to see them and get feedback from folks that serve in that capacity. Judge Tackett and Judge Berg, amongst other people, went to Miami recently for the Miami Model Mental Health Diversion Workshop. Judge Jones and I went a few years ago. And in just a second, I'll toss it to Judge Tackett or Judge Berg if either of them want to update on what it was like observing Judge Lightman's program and the court that's down there. It's very hard when you go not to be a little bit envious, but when you step back a little bit and talk with your colleagues, if we can't replicate it, we can at least get some inspiration from it and adjust our aspirations for what we can offer people in our state and in our communities. And I'll go ahead and just introduce our work group lead so that we can pass the mic around and be a little more efficient this afternoon. For pre-arrest and diversion, our leads there, Joe Ross and Jim Daly, they're unable to attend today, and instead of reading you their quarterly report, I will just go ahead and say, take a look at it. It's in your packet. It'll touch on everything you need or want to know. If it speaks to something that you're interested in or something you think you might have answers on or something you might want to continue the conversation about, please contact Shauna and let us know so we can get you involved in that work group. We also have good updates coming from Director Slusher with KCPC. And everybody's always curious to hear more about what's going on at KCPC, although she speaks to things in a subject as a subject matter expert that are not only related to KCPC. So, and then we'll have Judge Jones in a moment talk about the Juvenile Justice Work Group. I'm going to go ahead and pass to Judge Jones, then maybe to Director Slusher, and then Judge Berg or Judge Tackett if either of you all want to talk about the workshop. So.
Thank you. Our Juvenile Justice Work Group met twice since our last commission meeting.
So we had done virtual mapping of our juvenile justice system in Kentucky. And so we've completed that process, and it is with the National Center of State Courts right now to give us the results of that. And they're compiling those results. I think they're also working on merging those results with the upstream, which was the dependency, neglect, and abuse mapping that was done, because there is such overlap in those systems and in those services. So we're waiting to hear back from them as to what the results of our mapping are going to be. But as a result of the mapping, we prioritized crisis services for youth and where they fit along that continuum of care. And we had a presentation on how Medicaid fits into that continuum and changes that might be coming in the current year to at least certain areas of the state. We also had a survey. In the course of our discussion of our juvenile services, we realized, at least anecdotally, that vaping was a very contentious subject among the schools and the counties across the state, and that it was being handled very differently in different areas. So we were getting that anecdotally, and that's we saw that as low-hanging fruit, a way to find out, is there a way to stop juveniles from entering the system if we can find a way to address this and make recommendations for how it can be handled uniformly to divert kids out of the system. Because we had heard, again, anecdotally, that some places were sending kids to court for this rather than sending them through the CDW's office. So we have prepared a survey, and we're sending that out to the CDWs and to the county attorneys across the state, and we're waiting to get the results of that back so that we can have a better picture of what's actually happening, so I don't have to keep saying anecdotally. So we are also, as far as action items, we're waiting for that report back from mapping so that we can look to see where we go from there. We are looking to identify and solve barriers to adolescent involuntary hospitalization. That's still one of our key issues. And we are, again, wanting to learn more and educate the public more about positive and adverse childhood experiences. And also, it's come across our radar that the competency of juveniles and juvenile justice system and restoration of competency for juveniles is an issue that I believe the competency group has asked us to look at as a juvenile work group, and hopefully we can start collaborating on that as well.
Hello, everybody. So our competency work group, we have been very active over the last quarter. We had Ryan Becker from AOC, legal counsel, come and talk to us about a gap in standardization of reporting the need for firearms prohibition for people who are adjudicated incompetent. So we have come up with some recommendations that are moving forward to standardize that process and improve the quality of the data that moves beyond our system. Last time I was here, I spoke very little about an LMDC pilot at Louisville Metro Department of Corrections Jail pilot around starting a competency restoration program within that facility. So we're continuing to make some headway there. At the time, we had thought about serving one person as we move through a system and just basically collaborating with local partners in that area. And we now have 5. So Judge Burke, 2 of the patients are actually from her court. And so that just speaks to how we can make a lot of system change at a local level, which we went to Miami and we heard that was basically a big takeaway for me, is that sometimes you can't get those big legislative or system changes happening at one time, but you can build coalitions around this work at the local level. So we're seeing some progress there, and that is truly through a partnership of the medical provider within that facility, since we do not have any funding at this point, but we have shared interest in improving that system. It's a very much a research-based initiative, so we're really building in quality admission criteria that research tells us will work most effectively. And we're gonna look towards streamlining process through template language and evaluations that come out of KCPC to really help guide the courts where they need to go with particular patients that we think can be best served through this process. And we're building in a dorm in the jail that is specific to housing patients who meet the criteria, but also thinking about expanding that to people who have evaluations and are waiting for those for KCPC, but have specific behavioral health issues that we can address at the beginning of moving into the jail system. And we created a visual diagram. I tried to do it on PowerPoint, didn't turn out so well. So our technical assistance advisor, Council on State Governments, is creating it for us in a better platform. And it is a decision tree based off of research that tells us where to start expanding efforts based off of the allocation of resources that already exist versus what the future holds. And so it helps guide communities of here we need community-based models and here we need jail-based models. So hopefully that kind of information will help streamline process and help expand understanding of why we need to expand services around competency in the state. Which goes to our action item. We continue to explore recommendations for promoting outpatient evaluation processes. As you know, KCPC started that 1.5 years ago. We want to continue to expand that where we can and mirror states who have already been implementing that. So as a reminder, every time we get the chance to say this, I do. Tennessee has been doing an outpatient-only evaluation process since 1974. So there we go. It works. The technical assistance, we are also helping us, Council on State Governments, with looking at screeners. We continue to bring this up. It's a difficult area. Part of the work we're doing in LMDC pilot is creating a screener of our own to indicate to the providers at KCPC, we continue to do those evaluations, when the patient is ready for reevaluation. So they are helping us, Council on State Governments, to learn nationally what that practice can look like or does look like currently. And there's not a whole lot out there, but we are continuing to dive into that. And continuing to look towards data from AOC to inform some next steps and to clarify and promote, which we haven't touched on recently, but we need to add that to our next meeting about modifying or rescinding orders. Any questions about competency? Thank you.
And I think next we will hear from the Civil and Family Justice Committee, Judge Cutoff.
All right, good afternoon, ladies and gentlemen. I'm proud to be here with the Civil and Family Justice Committee. We've got some wonderful people who work on this committee, and Shauna and her team takes care of me and everybody else. Dr. Katie Hopkins is the vice chair of the committee, so their work is invaluable to what we do. Our work groups are led by Stacy Tapke. She does the Guardianship and Commitment Work Group, which has branched off into a guardianship sub-work group and a commitment sub-work group. So she actually does 2 different meetings. Judge Denise Brown does the domestic violence work group, and Judge Marcus Vanover does the dependency, neglect, and abuse work group. And Judge Brown and Judge Vanover are online. We'll get to them in a second. I wanted to touch very briefly on what we did at our meeting October 19th. Well, we heard a very good presentation on alternative response, family-centered and strengths-based approach to child protection. We had Chelsea Herod and Sierra Jackson from DCBS come and talk to us, and they presented an alternative model to the normal investigation response that DCBS does. It's a model where they go in and they work with the families voluntarily. There's not a named perpetrator, so to speak, and they go in and they work with these families, and they're getting really, really good results. It's been implemented in over 25 states across the U.S., and we've got 2 areas, the Northeastern and the 2 Rivers regions of DCBS, piloting this alternatives response program. So hopefully it continues to work. They've done over 50 evaluations, and they are finding consistently that child safety is preserved, that everybody, families and caseworkers, are more satisfied with the process and the outcome. So I think that's really cool, and it's a good thing going forward. I think that's, when I represented people doing dependency, neglect, and abuse cases, you know, you've got the perpetrators, somebody who allegedly committed this act, and everybody was very tense and seemed to be at each other the whole time. It was this person versus that person. And this way, where they're all working together from the get-go, getting better outcomes. So, and hopefully keeping people out of court. So there's that. So that was a very good presentation. I'm going to briefly, I'm not going to read Stacy Tapke's reports. I do want to note with regards to the guardianship stuff, in your paperwork it says The work group seeks to understand and respond as needed to changes relative to the outcome of Webb versus Beckner and CHSF definition recommendations regarding the qualifications of assessors. It's actually Bettner, B-E-T-N-E-R. It's a Court of Appeals decision July 14th of this year. If you're familiar with the guardianship process, we hear from an interdisciplinary team. It's a doctor, it's a psychologist, and it's a licensed social worker. Or somebody who works DCBS social work background. In this county, I think it was Meade County, they were using as the third person a psychologist who was not a social worker, but they worked for DCBS. And the Court of Appeals said that is a no-no. You cannot do that. You have to strictly follow the statute and have a licensed social worker or a social worker who works at DCBS. And not all counties, not all 120 counties have been doing that apparently due to the lack of social workers. So this work group is looking at that definition. I think they're going to make some legislative proposals to see what they can do to get more in line with what has actually been happening in those counties. So from the district court bench, that's something that happened that was somewhat disturbing and almost alarming, that we had cases that might have been void from the get-go. So we appreciate Judge Thompson's colleagues at the Court of Appeals telling us that we need to do something in a certain way. So we'll get that done. You can read the rest of their stuff. I'm not going to read it to you, but I just thought that was important. So we'll start with Judge Brown online, there from the Jefferson Family Courtroom, I believe.
Yes, I'm here.
Go ahead, ma'am. Thank you.
Okay, we last met on November 17th, and our work group has continued exploring all the data reports, looking for trends and opportunities. We're also making specific data requests as needed based on the other projects that we're working on. We've also shared updates as the Violence Against Women Act needs assessment and how it has informed other priorities. We provided information for the Family Justice Center and shared that with the work group, and actually have decided to start a subgroup that's going to begin collecting resources and other models being used statewide that could inform the implementation of more multidisciplinary teams statewide. We've explored limits to the bond system notifications, and particularly around engagement with mental health facilities, discussed somewhat some of the minor issues with Vine as to when it's down and we're not able to access it. And then also work will continue with the creation of a bench card noting best practices regarding dismissal of domestic violence cases. Our action items include exploring the procedural training to address the stigma and experiences that re-victimize survivors or create an atmosphere of coercion. One of the things that we are looking at is have a group come in to kind of do an assessment of our justice centers for specific courts that volunteer, that want to have some feedback on the perception that may come from a victim coming into the building and just walking through and going through the process. So we haven't finalized all that we're going to do on that, but we do have a couple of locations that have volunteered that would like to have that. We're drafting a bench card with best practices. We're reviewing cases where the petitioner is seeking a dismissal, and we're also drafting bench cards on stalking and strangulation. And we're researching current school partnerships, barriers, and legislations, looking to perhaps implement some of the things that have been occurring statewide in regard to connecting to the high schools and making sure that we're providing information to help students be aware of mental health issues.
Any questions? Judge Vanover, I think we're ready for you, please.
Okay. In regard to the dependency, neglect, and abuse work group, we have been working on 3 priority areas over the last year. The first priority area is enhancing collaboration with system partners. That work's been working on including, on a local level and on a wider level, partners within the dependency, neglect, and abuse area with youth services, the cabinet, and court resources and court personnel to kind of come up with a better way to make sure that we're communicating better and that we're, identifying areas that need work and need improvement. And that's obviously always going to be an ongoing priority area that work is being done in. Our second priority area was understanding the role of treatment providers. And we have, that priority area has developed a bench card to be used by judges with information pertaining to mental health professionals. The bench card is addressing roles and responsibilities of mental health professionals, addressing the difference between screeners and performing specific assessments, considerations to use when judges are writing an order for assessment or for therapy, dealing with expert witnesses versus fact witnesses and which type of provider qualifies under which role. It also helps with how to evaluate testimony as far as whether it's you need experts or what licensing you need to hear before you hear from those individuals. And it's also to highlight some concerns that we often hear regarding billing for court appearances for behavioral health professionals. While this is designed to assist judges in dealing with various responsibilities of mental health professionals within our court cases, this is also going to try to be distributed to folks from the cabinet, to our appointed counsel and other attorneys that are involved in the court system, and to the providers themselves. Right now, the large part of the bench card has been done. I think it's going through a legal review just to make sure that we get everything official before we get those printed up. And then the next steps will be determining exactly the best way to distribute that to make sure that it reaches everyone that needs to be. So the work regarding the bench cards is getting to the end. Our third priority area has been to create a best practices and resource guide for child welfare partners. The work has been trying to collect the resources that we have and identify gaps in those, and to research, to put those together in one place in a resource guideline that's available to everyone and that we can distribute. The large portion of this work was done by Mary Carpenter with the cabinet. And it is also in the final stages of the review process. Again, we're trying to make sure that we get the legal ins and outs approved before that's ready to publish and distribute as well. We have also since we're getting close to the end regarding those two priority areas with the bench card and the best practices guide, we started looking for other priority areas that we could utilize. And following one of the town hall meetings that occurred earlier this fall, one of the participants at the town hall started reaching out with questions about, well, here's what my concern is and here's what we need to deal with. And she was a court-appointed attorney who deals with our dependency, neglect, and abuse cases in a couple of counties. And she started talking about issues that she was facing in dealing with youth who are facing mental health issues and trauma. And, her clients were coming to her with concerns that, she didn't really know how to deal with. It wasn't exactly legal training and wasn't something that was, heavily focused as far as the legal training goes for court-appointed counsel, and didn't really know how to deal with that. So in looking at the family court rules, which allows for training for our court-appointed attorneys for behavioral health and for child development, this priority area in this work group is going to start looking at developing training for court-appointed counsel that deals with mental health and trauma, and how to address and to give our court-appointed attorneys kind of a basic framework on how to answer some of these questions and how to identify the issues and make sure that they get their clients headed in the right direction, make the right type of referrals and service them. And we're trying to figure out how to incorporate that not only into that specific training, but perhaps into the statewide trainings that we do for our guardians ad litem and court-appointed counsel on a general basis to make sure that they're prepared to deal with all the issues that they are facing. Let's see. We also have been working on the upstream project with the National Center for State Courts. We've talked about that several times over the last year. As we've mentioned, we had our statewide mapping event there in that room where most of you are today on August 30th and 31st. The National Center has been working on their mapping report for our dependency, neglect, and abuse actions. I think a draft is getting close, and hopefully within the next couple of months, or certainly by the time we meet again in March, we should have that report and ready to provide that to the entire committee for review is our hope. As Judge Jones said earlier, once we started getting into the mapping for the juvenile justice and for the dependency, neglect, and abuse, and we saw the overlap, that's one thing that they're trying to do is make sure that we're not trying to reinvent the wheel, that we're addressing both aspects of juvenile justice and dependency, neglect, and abuse, and how those facilitators and how those mapping and how those resources can work together. So we're excited about getting that report and beginning to work on our upstream project. Once we have that report, I think the next step is to identify some facilitators and get those folks trained. That is my understanding. Those facilitators will work not only with the upstream, but will work in the mapping for juvenile justice and for the adult sequential intercept mapping. So it's been a long process on all of those to start working, but I think we're getting close to having those reports and ready to start identifying our facilitators and putting the information in those reports to work. And let's see, I think that's all we have. We will have another work group meeting in January 16th.
That's all. Thank you. Now we will hear from the Treatment and Access Committee, Judge Kevin Mullins.
Thank you. The underlying foundation structure was strong.
Judge, if I could interrupt you, I'm not sure your mic is on, or if it is, you're going to have to put it up a little closer.
All right, we'll start over. I don't know if it's working very well. All right, the underlying structure, foundation, or cornerstone of the Treatment and Access Committee has always been community involvement, community education, and community support. The Treatment and Access Committee would like to acknowledge the receipt of the second gift of this year for both the committee and the citizens of the Commonwealth of Kentucky. The first gift that we received was towards the end of May and 1st of June, where we had our summit in Louisville. Look at the exact numbers, 1,168 people in attendance from every county in the Commonwealth attended that event. The second gift that the Treatment and Access Committee received started on August 30th this year and ended on November 29th of this year, wherein the chair, the administrator, and a lot of efforts from a number of other people put on 9 town hall meetings. These meetings were from Ashland to Paducah, and they truly met people where they were at. There were 1,030 people who attended these meetings. Obviously, we're very thankful for everyone's efforts to put forth this event and these events. I attended, was only able to attend the Pikeville Town Hall meeting. Okay? And I would like to share with you some observations that I have just from attending the one meeting I'm sure that there were similar observations statewide. All right. The first observation that I attended or observed at Michael was there were people there who had never participated before. But these were actually people who needed to be at the table. Appalachian Regional Hospital sent a group of people to that meeting. Okay. It's the first time I think that they had expressed an interest. And following the meeting, I thought it'd be a good idea to touch base with them. Unfortunately, by the time that I could touch base with them, Justice Lambert already had their head of behavioral health assigned to the competency work group. But we continued to follow up with them. I think a couple of weeks ago, me and Shauna had a meeting with Appalachian Regional Hospital, which runs 3 inpatient and voluntary psychiatric units in Hazard, Harlan, and Prestonsburg. We followed up with them, had a great meeting. They've shared with us, they came with, I think, an email yesterday that I haven't had a chance to look at, that we were interested in their intake data. Okay. As an example, if you had 1,000 intakes last year. Were those all different people, or how many of those were the same people? And they were very eagerly provided us with those. So my first observation was, I think in these meetings that there were a lot of people who hadn't been to the table, that no one's fault, that we were able to recognize and then bring to the table. So you probably get some new members on the work. The second observation that I had at the PICE meeting, the majority of people in attendance there and the majority of the discussion there were people who were in treatment or in recovery from a substance use disorder. And that seemed to be the focus of the majority of the meeting. And following that meeting, it caused me to recognize that is our existing structure in Kentucky. We have the best substance use treatment structure in Kentucky, better than anywhere else in the nation. And that's not just my opinion. Michael Mead, who I consider the preeminent public health and rural health researcher, testified, had a presentation at our summit, and he said in his opinion, based on Kentucky's structure, that we would probably be one of the first states to recover from the fentanyl epidemic that's sweeping the nation. So I think the task that we have at hand is to recognize our structure is a substance use structure. And it doesn't take a lot of thinking to figure that out. We have Operation Unite in the room, who's now celebrating their 20th year in existence. We have Casey's Law, which has been around, believe it or not, since 2004. We have a lot of different organizations. Northern Kentucky Hates Heroin, Voices of Hope in Lexington, a new kid on the block. They're 10 years old. They've been at this 10 years trying to help them. We have to acknowledge our structure. We have to look at the fact that Kentucky has the biggest and best needle exchange program in the nation. Okay? Courtesy of the Office of Drug Control Policy. These aren't my opinions, these are just pure facts. We have to acknowledge that. The reason why I think that is important to acknowledge our structure, because I think the task at hand for the Treatment Access Committee is, how do we retool, how do we refit this existing structure to include behavioral health issues, serious mental illness, intellectual and developmental disabilities. I personally believe the timing is so crucial because I just looked up the opioid abatement numbers. Okay. They have 23 prevention grants which have been approved. They have 36 treatment and recovery grants, total 59 grants, $32.5 million. That covers every county in the state. All these different programs are just waiting on the check. Okay. Also, I just got off the phone with Brittany Allen, who's now moving forward. She's very excited. They have 14 recovery community centers, a new one scheduled to open next year in Laurel County. The Substance Abuse and Mental Health Service Organization is issuing grants to CORE and to other individuals. So we have a ton of new programs that's coming out for substance use disorder. We have to figure out a way to include in the distribution of information, education, issues, again, mental health, behavioral health, intellectual and developmental disabilities. We have to follow that structure that's on hand. I think it would be a waste of an opportunity if we did not. I'm going to talk briefly about our work groups. The first work group is the Intellectual and Developmental Disabilities Work Group, which is now led by Crystal Adams. She's been with the work group since its inception. She's just gotten an extra or some additional roles, which she's handled flawlessly. Also, on that work group to my left is Steve Shannon, who's assumed a lot of the responsibilities, provided us with a lot of resources, and helped us considerably. The next work group we have is the Court Responses Work Group with Judge Work. She has put tireless energy and effort towards trying to modernize our involuntary hospitalization process. And then our final work group is our Strengthening Community Work Group that's led by Wes Butler. Obviously done a fabulous job on that. Just in general, I've watched and been part of different work groups. Each and every work group that I watch, I leave the same thoughts and feelings. Wow, how professional. Wow, how organized. Wow, how diligent. So our work groups have been absolutely fabulous. So I'll turn this microphone, which I'm not sure if it's it or maybe it's not working correctly, over to the ladies and let them tell us some more details.
We won't find out yet since this is a different microphone. So the Intellectual and Developmental Disabilities Work Group we started off, of course, going through the intercepts and really focused on the early intercepts. And a couple of themes have really emerged. And I would say those are identification and education. So we have looked at a couple of different processes. We have looked at kind of the pretrial process. We've looked with our youth at the court designated worker process. And so we're trying to figure out how do we make sure that the officers of the court know when an individual with an intellectual or developmental disability has entered the system so that they can be aware and so that they can take the appropriate steps. And then also providing the education to the courts on how to proceed from there. So we have heard from pretrial. They have come and presented to us and talked to us a lot about the assessment process and the interview questions that they ask. And we've had some continued discussion about how we can potentially recommend changes to that to give the officers of the court very early information about an individual as soon as they've entered the system, and to make sure that a lot of the decisions that are made are appropriate for those individuals. We have looked at how we can include individuals with intellectual and developmental disabilities in some of our diversion programs. And then the other piece that we have looked at some of the behavior that we've seen through the school systems, and looking at how individuals are sometimes entering the courts, our juveniles are, through the school systems, and looking at the CDW processes, the questions that we look at to see how our data is correct or incorrect and how we're identifying these individuals, and how we can get better data and better assessments through that process as well. What we focused very heavily on and we're very excited about is our work in terms of providing education. We are in the process of building quite a few modules that we expect to have ready by our next fiscal year on a variety of topics that we're making available that are currently under development. Our goal is to make those very accessible because they're pre-recorded. They're going to be in smaller amounts to make it easier for our judges and attorneys and other folks in the courts to do these trainings, to become educated on these variety of topics when time permits them to do so. The beauty of this is as we complete these, there's room for additional topics. There's room to build on that knowledge as we give that baseline and give individuals a good understanding of this population, and also to see as they start to learn what areas they feel they need more information about. Justice Lambert has brought to our attention some of the great work that has been done in Pennsylvania in regards to individuals with autism in the courts and a toolkit that they have developed there. And she has been very excited to bring some of that here to our state. And this work group is going to be working to do some of that. We are looking at the work that they've done and how we can replicate some of that. And also working with our self-advocates here in Kentucky to identify what we believe also may need to be included in that, anything in addition to the good work that Pennsylvania has done. And so we will be continuing to work over the next few months on getting those trainings ready to go for everyone. We're going to continue to explore how we can make formal recommendations for those changes to some of the early processes after arrest with our court designated workers for our youth and through pretrial for our adults. And then we are going to, at that point, look into what we can do later on with the other part of the intercepts, because we've identified a lot of things very quickly in the early parts of the process. So we've got a lot of things to work on for months and years to come. And we've also identified a lot of opportunities from the work that our other work groups are doing. So groups such as our competency work group, our commitment work groups, of opportunities that we can to provide information to the work that those groups are doing on that population that we're looking at and help them inform some of the great work that they're doing. Our next meeting is actually tomorrow, and our goal is in honor of the end of the year to try to look over our work plan and wrap up any loose ends that we have and make sure that everything we've identified that we want to be working on has a clear lead and a good plan going forward.
All right. The Court Responses Work Group has met in person and remotely, and we have met with stakeholders from very different parts of the community and also with the Treatment Advocacy Center to discuss modernizing the Civil Commitment Statute 202A, specifically in relation to how we can expand the criteria for civil commitment to include allowing hospitalization for those adults with a documented history of serious mental illness who are in a state of psychiatric deterioration. As we know, we see these people over and over, and the way the statute currently reads, you pretty much have to wait until the worst case scenario. But other states have adopted language which allows individuals who have a marked documented history of their serious mental illness, if you can get them back into an evaluation setting and show that they are declining, you can stop that decline with hospitalization. And the goal of that is to keep these seriously mentally ill adults well longer and to reduce the recidivism of their illness and the constant cycle that they go through of hospitalization and arrest. Also we have discussed modernizing the language to be more inclusive and to include terms that decriminalize the mentally ill. As we know, some of the language is outdated, and we've worked on that. And I'd like to say one of the things that I have noticed with all the things we've been talking about today is with respect to the seriously mentally ill adults in our court system, one of the most positive things that I have seen happen is that Director Slusher coming into her position with her knowledge and expertise is something that is adds a lot of hope for us in the system, because we're seeing real changes from the bench in the justice system, in the correctional system, in our local jails. She has done so much to make change, and so it's these partnerships that we're working with and things that we can do. Our committee has also discussed how we can continue to make uniform protocols with corrections, meaning the local jails and the courts, to simplify that procedures, particularly with respect to individuals between the different level of courts, between district and circuit, and in those time lapses when people are in custody but awaiting going to the next level of court. Also, we have discussed ways to support our specialty courts with the help of Debbie Hall. We have talked about education of our attorneys, prosecutors, public defenders, judges, and the community about how to access specialty courts, and just the fact to make more awareness. We need more public awareness that these avenues of assistance are available, and particularly for potential utilizers who may be in the system and not know that there is help within the system. We have discussed helping to find ways in funding to expand those programs and to help get some public information by way of maybe media or print. And we also have talked to Judge Leach, Judge Jessica Moore, Judge Tackett, and myself. We went to the Miami trip this spring, or last month, and in that we had the opportunity to see their mental health diversion program. I think calling it a diversion program doesn't do it justice. They call it the Miami model. Calling it the Miami model does it justice when nothing else is like it. I don't believe anyone else in the country has done what they've been able to do. They have a system where they have created a community of trust among their law enforcement and their courts, which has allowed the mentally ill to be treated with such compassion. And there's no pushback. Everyone's on the same page. Their law enforcement has created a system that actually accommodates individuals who have serious mental illness. And when they take them into custody, they know how to assess, they're educated on how to assess these individuals, and they often bypass the courts and take them to treatment. They have been able to manage funding because they have reduced the homelessness rate of their seriously mentally ill adults so much that they have been able to they have been able to get the city's bond rating increased. And because of that, the city then gave them so much more money, they've been able to open a facility. This facility will act as a triage center for individuals who are taken in by law enforcement. The individuals, when they're taken in, they'll be taken to this facility and they'll have all access to medical, dental, mental health, and they'll even have a courtroom inside. And this facility is something that we could do on smaller scales across Kentucky in different communities. We obviously couldn't do it on the level they are doing it, but it is something that we're exploring in our committee to talk about how we can use some of their crisis response measures, some of their information sharing systems, and some of their other interventions that come from the court. And it was the judges who drove this. One judge in particular And the whole process, obviously took them 20 years to get to the point that they are now, but they were able to accomplish something that I think would be a lofty goal for Kentucky.
Well, good afternoon. I'll be speaking on the strengthening community response, and as the last work group, I've noted the time, so I will stay at a high level so that we can stay on track. Our work group is comprised primarily of, as the name describes, community stakeholders. We've got healthcare provider, community resources, and others that have spent the last several work group meetings kind of visioning the different obstacles and objectives that they wanted to tackle. And generally speaking, I would group them into three different settings: access to care, coordination of care, and then early interventions. Those are the three themes that continue to be discussed through various discussions within our group. But within the last quarter, we've had a couple of meetings. The first meeting was talking particularly about access to care through transportation. And Medicaid Commissioner Lee was sharing some of the innovations that her office is putting into place and has put into place in the recent term, that explains a little bit about how they're trying to meet that specific need of making sure that individuals are at the right place for treatment, for care, and those things. That was wonderful. The more recent meeting that we had was on early interventions, and we had presenters talking about positive behavior in schools, a particular model for identifying mental health concerns in our education system, so that there can be access to care, resource interventions at the earliest stages. Because a lot of times what we're finding is that the issues that we see in adults are actually, if you look further back, you can find a lot of the same types of symptoms and issues earlier on. So if we can address those needs with targeted resources earlier, we might hope to get better outcomes. The third meeting that we're going to have on January 9th, Tuesday, January 9th at 1 p.m. Eastern Time, is about crisis services, and particularly we've got individuals from the University of Kentucky and Eastern State Hospital talking about the empath model. And we've had prior meetings in which crisis services have been a topic of interest for many of us. And the University of Kentucky has implemented this empath model in a fairly recent term. And if you've not been familiar with it, I'm really going to encourage you. I have my new friend, Dr. Sessions here. I've already recruited him to come and visit us and listen about it. And I'm going to encourage all of you. They're going to give a short 20 to 30 minute presentation on the empath model that they have. And it's basically an outpatient model for crisis services at Eastern State. And then we have engagement afterwards, usually 20 to 30 minutes of engagement with questions and issues. And we invite other stakeholders to talk about other models throughout the state that may be also in place. So looking forward to that. Again, if you need the date and time, flag me down. You can always talk to Jennifer. Make sure we get you the Zoom link for that. That's all I have to report.
Wow, how exciting was that to hear all the work that's being done by these work groups all throughout the year. And it just gives me chills to hear all the exciting things that are going on and all the very knowledgeable people who are making the positive changes. And I know even more can be accomplished in the coming year. Thank you all who are here, both in person and by Zoom. I want to remind you that the new dates for our upcoming year are at the end of your packet. Our next meeting date is March the 14th for our quarterly meeting. Your work groups will be held, I presume, much before that, but the quarterly meeting date will be, the commission will be on March 14th. And I would like to remind you to leave your table tents where they are and to leave your name tags here on the table as well. I certainly want to wish each of you a peaceful and wonderful and happy holiday season. I certainly look forward to all we can accomplish in the upcoming year. And last but not least, Rabbi Litton was able to join us here before our meeting closes. And he wants to issue a personal invitation to each of us who are here in person to participate in a menorah lighting right after the meeting. If you would like to stay and participate in that, it will take place right outside, and we will direct you to that if you'd like to stay. Thank you very much.